For the most part, it's month-long rotations, and during third year they're required rotations, so all of the key, what people would think of in clinical rotations, family medicine, internal medicine, pediatrics, OBGYN, surgery, psychiatry, and then there is some time for elective time. And then fourth year is really what we call the audition year, which really when students are looking towards the match and deciding what kind of medicine do I want to practice and where do I want to go to practice it, it's their chance to go for 2 or 4 weeks and show the hospital what they got.
It's a little different than studying in the classroom, in that now everything you learn has a real human focus to it. So pay attention even more. A lot of students think, oh, the third year gets easier, and in all honesty, the third year gets harder because you now not have to just learn for yourself, but you're learning for that patient you're seeing. So kind of keep that in mind, that there's a reason why you're trying to learn all these things.
I think most enlightening about the rotations is where medicine came to reality. The first 2 years we're in the books, we're studying for tests, and everything becomes very ethereal. But our third year and our fourth year, we start putting names and faces to the pathology and to the diseases. And it's both enlightening, but it's also both humbling as well. We start to, instead of seeing the disease process or the labs or the images on the x-rays or MRIs, we start seeing the suffering, or we start seeing the joys of when they beat their disease.
I was really nervous when I first started and not really sure of my A, intellectual ability, and B, my ability to manage a case. And now I feel a lot more confident. I know where my strengths and weaknesses are, so I know when I'm excelling and I know when I need to ask for help. And I think that's something that you just learn by trial and error and getting feedback from people about when you do need help.
The tendency when you get done with second year is to say, okay, I can jettison the books and the learning and the long hours, and actually what students find, and we tell them, but until they live it, they don't appreciate it, is that you actually work harder and study more on rotations, because all day long you're doing the clinical medicine. You're taking notes of, I didn't know the answer to this question, and I wasn't sure about this, and boy, when you get asked a second time tomorrow, you better know the answer. So it's naturally inclined to go home and look it up and find out what that answer is, but it's also learning in the environment. So in second year, when you're learning about heart attacks, you're in a vacuum. When you've seen a patient that's having a heart attack or that is recovering from a heart attack, it brings it full circle and home, and you get to really learn it completely.
Better to be out of the classroom and actually seeing patients and actually utilizing all that information and all those late night study cram sessions, and you actually see all the knowledge put to use.
You're sitting in classroom and you're worrying about me. Now you come out and you're working more of a team. So we've tried in the first couple of years to develop teamwork, but it doesn't really hit home until you get here. So helping them understand the nurse's role, helping the physical therapy role, the dietary role, all of those things we try to focus on and emphasize while the students are here on our rotations, so that they know they're not alone, they're not in a vacuum. It's a team approach to patient care.
One thing that's been really surprising to me are the nurses, and if you're nice to the nurses, they will give back to you 20-fold. And so that's been really an important lesson for me.
The first couple of times you treat the patients almost like a test. You try to ask the right questions, you try to get a feel for what's going on, and before you know it, you become comfortable with the patients. And especially being in a hospital, you get to see the same patients day in and day out. You get to see how their disease either improves or worsens. You get to see how they're doing and how their family does. So by the end of it, you're starting to develop a relationship. And a lot of times, as a student, you sometimes have more access to the patients than the doctors or the residents do.
Every rotation is an audition rotation. And I think, you know, sometimes, especially depending on the age of the students, will come in and have kind of what I call the undergraduate mentality. I'm going to binge and purge the information and let me get through the next test, let me jump over the next hoop. And what they sometimes fail to realize, and it's just the process itself, is that this is their career, this is their craft. So that you want to take the time, you want to learn, you want to be, as we say, the kind of physician that you would want to take care of your family.
One of the things that I really noticed that helped me decide what I want to do is, at the end of the day, what did I go home and study about? Was I studying about diseases in kids? Was I studying in adults? Was I studying more the slides or the images or the procedures themselves? I think everyone kind of takes their own view to it, but that's kind of where you hone down and really focus your attention later on.
Be confident in your abilities. Think about the things that you enjoy doing and why you went into medicine, and use that as your motivation each day. And then in the evenings, read a lot. Reflect on what you learned that day, because it will come up again and again, and the more you review, the easier it is the next time. And to enjoy the process, because it really is fun.
I think back to everything I've learned this year and actually learning how to care for patients. It's awesome. you don't feel like a doctor yet, but you definitely feel, you don't feel like that dumb second year anymore. Now you feel like the dumb third year, but who knows a lot more.
Students who are now thinking, when am I ever going to get there, or how long is it going to take to get there, and are maybe bogged down in the material, hang in there. Keep upbeat, because it won't be long. You'll be here taking care of patients, and that is the thrill of being a doctor.
You never know as much as you want to know, and sometimes the things that you do know you can't put into practice, and that just comes with time.
But I think if students approach it of, this is my career, this is my craft, I've invested an enormous amount of time, money, and effort into this, I want to be the best possible doctor that I can be, then I think the sky's the limit. And that represents themselves well, it represents osteopathic medicine well, and it represents DMU well.